Welcome to EyeConnect, a podcast from Ocular Melanoma UK, where real people share real stories about life with and beyond this and other rare cancers. Ocular Melanoma UK knows just how powerful it can be to hear from others who truly understand the journey. From laughter to loss, science to support, each episode connects voices from across the ocular melanoma community. EyeConnect, bringing together people and stories. Hi, and welcome to EyeConnect, Ocular Melanoma's podcast. And today, our guest is India Gooderham. India is a former physiotherapist who specialized in oncology and palliative care. She is the founder of gentlerecovery.com, an online program that helps people navigate life after cancer treatment through exercise and physical therapies. Her passion is really about bridging that tricky space between the end of treatment, surgery, chemo, radiotherapy, and getting back to everyday life and independence. Through Gentle Recovery, she brings together movement, yoga-inspired exercise, relaxation, and self-care, all designed to support people in their recovery journey. She's worked in the NHS and seen firsthand how diagnosis and treatment are well covered, but how rehabilitation often isn't given the same focus. That's what inspired her to create Gentle Recovery, and I can't wait to dive into her story today. Please join me in welcoming India Gooderham. And finally, I can welcome you to EyeConnect, our podcast. It's so lovely to have you here, and thank you so much for giving us your time. Do you want to tell us a little tiny bit about yourself and what drew you into kind of becoming involved in the practice that you're in now? I mean, you started out in oncology physiotherapy and palliative care. Was there a personal reason, or how did you come about?
Yeah, it's a bit of both, really, I think. So my background is physiotherapy, working in the NHS. And I think a lot of what I witnessed there, I learned a lot about kind of cancer in terms of treatment. So I, journeyed alongside a lot of patients going through different cancers, different treatments, and different stages in their treatment and recovery. So a lot of what I learned was that people were getting amazing standards of care when it came to the treatment, the active phase. But then as a physiotherapist, if I was working further down the line, so maybe in musculoskeletal or in more outpatient practices or within the community, I was seeing that people were really struggling with the rehabilitation phase. So it was almost as if as the NHS were focusing very much on the treatment and getting that really right. But then there was a big gap. And that was supporting people from treatment to survivorship and that past those kind of acute stages of recovery and the longer term survivorship. So yeah, I was seeing people that were having conditions and problems that from what I was experiencing could have been, sorted out before it had become a problem. So if they'd had some rehabilitation support, then there were avoidable long-term issues. So,
is this just physical, India, or when I know physiotherapy is based around the physiological body, but weakness, fatigue, mobility, all of that also has a massive impact on your mental health and your ability to recover and basically your confidence as a person.
Yeah, absolutely. So I don't feel like you can separate it out. And henceforth, that's part of why I don't work as a physical therapist anymore, because I felt quite pigeonholed at one level. And obviously, a lot of my work, I would say, was 70% was the emotional, the psychological, helping people to know what's safe. It's terribly frightening to have huge surgeries, huge changes, or changing body, and what's safe. Am I going to hurt myself? Is this the right time? All these questions and worries and anxieties, even if people don't even just have that level of advice, that makes a massive difference. So people might not feel ready or safe to go back to exercise or start exercising if it's something that they weren't being doing pre-diagnosis. So yeah, that it is it's a massive part of it is like that psychological support, and it's a postcode lottery. Some places people are getting super great rehab, and other places it's completely non-existent, and they might just get a leaflet of like, these are your exercises post surgery, and they don't know when to stop doing them, like how to increase them. Yeah, it's difficult to witness that when there's so many things that could be avoided. And now with like so much evidence showing that exercise actually reduces the risk of recurrence by like significant amount in many cancer types.
Yeah, I mean,
Yeah,
it's
it's
fabulous.
amazing.
It's absolutely fabulous, and what you do for the cancer community is wonderful. So, thank you. It's
Oh,
and how we met as well through the cancer community, through the Penny Brown charity, and I just felt so comfortable being in your presence, even over the internet. I was just like, no, I'm happy to give myself to this person, and she knows what she's doing, and she can tell me what to do
oh.
with myself because I didn't know what to do. So
That makes me very happy to hear that. So yeah, I
yeah,
mean,
okay,
also
thank
like,
you.
going back to your first question, it's like, how did I like come towards this? And yoga has been part of my life since I was 18 years old. So I was struggling with an eating disorder. So I had really bad anxiety, depression, and an eating disorder, so a lot of control around food and things. And I was over exercising and really pushing myself. And so actually yoga absolutely saved me from that.
Fabulous, well done.
So yeah, it was incredible, and it became my sanctuary, and I really started to learn to like take care of myself and, change that whole way of being, because I was actually being, well, obviously like incredibly hard and damning on myself. And, from that point onwards, when I was working as a physiotherapist, I could see how yoga could be so, so therapeutic and supportive. But in the NHS environment at that time, it's not the same anymore. It's very, very different to when I was, first practicing as a physio. Like I was trying to bring yoga into my work. So bringing the breath, bringing the kind of all that, what we know now is the down regulation of the nervous system into my work as a physio. And that was really challenging because, most of the people were just like, what is she doing? Like, what is she talking about? Like, for me, it's just like, this makes complete sense. Like, yoga is
Yeah.
accessible to everyone. Like, can you breathe? If you can, then you can like get some, benefits from practicing yoga. And unfortunately,
Absolutely. I mean, it's not about standing on your head and being able to
oh,
fold in half or anything like that. It is literally down to the breath. It's the flow of the breath through the body. I mean, yeah, I'm a complete yoga lover. I've been a yogi since
yeah.
I was
So it's
17
about,
myself.
for me, it's all about, developing a sense of safety within, and
Mhm.
that's what yoga can really do. It's like you're bringing us to our breath, and our breath being our anchor and our place to come home to. So, like, I also draw on other traditions. So I have researched a lot into kind of Chinese medicine as well. And there's something that's really like got me and made me really being like, yes, that is what it is that I think can really help people affected by cancer, particularly. And it's this concept of the Shen. And the Shen is basically our spirit, our soul. And from a Chinese perspective, the Shen is depicted as a little red bird that resides in our heart space. And when we experience trauma, so however big or small that might be, but how it's perceived within us, that little Shen bird might fly away. And so it's the practices of yoga, meditation, Tai Chi, all of those things where you can get into your breath and you're down regulating the nervous system and you're creating that sense of safety within, is when that little Shen bird can come back and fly back into its little cozy nest in your heart. And that might sound really wacky, but like actually, like that makes so much sense. It's like creating that safety, and, that's how we kind of become whole again. And I
Yeah,
think
you're
there's
right. You have to have the safe space within your soul. Otherwise, there's nowhere to go. Yeah. Oh,
Yeah.
that's really sweet. I love that.
I really love it. And it just, for me, it's like every time I get on my mat and every time I'm teaching people affected by cancer, it's like, yes, exercise is really important. Strengthening the body is really important. But actually, it's like, I want those four corners of your mat to be your safe place and that place where you can just come back to yourself.
You mentioned that you struggled with over-exercising and an eating disorder. So how do you balance, and where does the line fall where you learn to control, not to push yourself over that edge, where you use the exercise that you teach yourself, and for someone to realize, actually, before treatment I was perfectly capable of doing this, but since treatment I might still be flexible, but actually I haven't used my core for 3 months because I've had abdominal surgery, or I haven't been able to put my arm behind me and I've had breast surgery or whatever. So what do we need to listen to help ourselves not go through those pain barriers?
Yeah. So, firstly, there's a massive undoing of cultural conditioning, I think, of kind of pushing hard to get results. So, that's what we've been brainwashed to think for many years. And there was the old adage, no pain, no gain, wasn't it? Like that was what
Yeah.
we were hearing in
Yeah.
generations gone by. So that's like hopefully boop out the window now. So yeah, really it's about, firstly, I would say really learning to listen to the body. So it's that kind of like when we let go of that conditioning, we don't keep pushing, even though the body's screaming like, I'm either feeling this discomfort or I'm in pain. Or equally, like, when you leave an exercise session, you should have more energy than when you started it. So if
So you
you
shouldn't be exhausted when you finish an
you
exercise.
shouldn't be like, well, flat out and like, okay, I can't do that anything else today. I'm completely spent. And then maybe that is ruining days afterwards. So you're needing to find a baseline level of something that you could do each day, probably most days with a rest day or two, and you leave it feeling more energized. And then when it comes to like during the sessions, it's like using your breath as your guide. So if you're holding your breath, if you are breathing, your breathing becomes erratic, then it probably means you're pushing too hard. So I love it that if you can just listen into the breath, and if it's nice and rhythmic, it means you're probably at the right level for you. So there's different ways you can look at it, but those
Okay.
those are the things I would
So
say.
yeah, tips and tricks that you kind of hold throughout the practice. And like you said, if you realize that you're kind of clenching your teeth and you haven't taken a breath for a few seconds, then
Yeah.
it's a little bit too much at the
And it's
moment.
just for me, it's like, again, it's like taking stock of what your body has been through. So we talk about trauma from a psychological level of like, being traumatized by something, but like your body has equally been through a trauma, and so it's like really acknowledging that and respecting that and being like, how would I take care of a loved one who's been through the level of trauma that I've been through? Because generally we're quite hard on ourselves and push ourselves. But if
Yeah.
this swung round and it was someone you loved, would you be like saying, okay, you're finding that really hard, but just keep doing it? Like,
Yeah.
would we
Just
say
keep
that?
going, you'll be
We
fine.
wouldn't. We wouldn't,
No.
So it's like bring that back on ourselves. Like, how do we, yes, return? And yes, it means like progressively making things a little bit difficult. So I'm not saying like, just chill out, relax, don't do anything. It is like it does take some effort, but it's about starting gently and progressing slowly. And it might feel painfully slow if you've been really active before. But if you really want to kind of get back to the levels that you were at, it's about that progressive return. And that's going to really reduce your risk of injury and kind of set like major setbacks.
Yeah.
But for
I mean,
me, my
you
job
talk
mostly is pulling the reins on people.
okay. It's like,
That's my job.
enough's enough. I'm thinking about the ocular melanoma community. Maybe 50% of the community has lost an eye through surgery or lost their sight. Even if they still have their own eye, a lot of sight damage. And that's traumatic in so many ways, but massively on the brain, because you have to completely recalibrate. You're wobbly, you've lost everything to one side, you walk into things, your balance is shot, you can't pour anything, you just spill stuff left, right, and center. So, I mean, we talk about trauma, and I suppose that, I mean, sometimes, like you say, you just need to breathe. And if you're thinking, well, I can't do any exercise yet, or I know you work with the breath and just calming the nervous system down. It's facing trauma. It is. It's tough, tough boundaries. It's going to take time after you've lost your eye, after you've had radiotherapy, if you've had major surgery through ocular melanoma, which has metastasized to one of your organs, primarily the liver, but it does shoot off in other places as well. It's going to take time. But there may come a point where you want normality to feel like normality, and you just want to feel human again. You don't want to be living this with this label over you of, oh, well, that's just me, the cancer patient. That's me with ocular melanoma. So you go back to work, and there's actually nothing physical on the outside with the dawn of prosthetics and everything that people are going to be able to see. But you might still need that time and space to focus your mind and body while you're back in the workspace. So how would you advise people going back to work on some mindfulness or some exercises seated in their lunch break? I mean, what would be your advice?
So what's really nice within kind of like a yoga practice, so we do lots of different like short exercises. So it could be really nice to, just have a few of those that you can spread out through the day. So there might be little prompts. So it might be, you're at the kettle and you're making a drink, and it could be that you stand there, and as you wait, you might think, right, I'm going to have a real think about my posture here. Okay. So within yoga, we call it mountain pose, which just means standing really with your feet hip width apart. But it could be like you check through your joints and you think, okay, so how am I holding my knees? Am I locking them out? Could I have a little soft bend there? Can you think about it's like lengthening through your spine, opening through the front of the chest, so your shoulders gently brought back and down. And then you just check what's happening with your neck. So you just give your head a little wibble wobble and check that it's free to move. So there's a moment where, you're just coming back into your body. So obviously within the work environment, it's all very heady. We're thinking a lot. We're, communicating with other people. So sometimes we can lose that kind of awareness of how we're holding our bodies. So everything is in front of us. So, computers, driving to work, sitting at a desk, all of those things. So it's really nice to just think about, you know, lengthening through the spine, opening through the chest and things like that. So you can, have some moments where you're reminded to check in with your posture, which would be really, really helpful. You could also have other prompts in the day to just take a few deep mindful breaths. So just getting the breath down into the belly. So if you're feeling more stressed, breath often hangs out, in your chest. So just taking some diaphragmatic breaths can just make a really big difference. So it just can be like a few breaths that are conscious through the day, and it could make a massive difference to how you feel. You could be circling your ankles as you're sat at the desk, getting your circulation going. There's lots of like lovely little things you can do. So like if you're able to join any of the lovely yoga sessions that we're putting on for charity, then you're going to learn things that you could then bring into a daily practice, and you just changing them around is great. So yeah, there's so much that can be done, and in very small, periods of time, so little moments through the day. And also you can do it and nobody needs to know you're doing it. So you don't need to feel like the wacky one practicing your corner.
You've got someone sat next to you going, why are her feet going like this? And I suppose, I mean, well, not I suppose, but by doing that, you come away, and that's probably giving your body time to heal, just in that space where you put your phone down for a second, or instead of while the kettle's boiling, you're not scrolling through social media or something. You actually getting forgive me if I'm wrong, but I think by getting the oxygen through your body into your blood and allowing it to flow, because you're not at 100 miles an hour, which is how life is paced, you're healing.
Yeah. Yeah. Yeah, and also alongside that, you are down regulating the nervous system. So in the work environment, often we can be quite stressed, depending on what we're doing for our work. But that's a common theme that I hear of. And by coming back to the breath, by just doing some mindful movement, gentle movement, you're supporting the body to switch out of that fight flight into a more rest and digest. And so, obviously, when we're resting and digesting, it means that energy and blood is flowing to those organs. Okay, so that's going to really support tissue healing and recovery. So if we're in fight or flight, the blood's in our extremities to dash and seek safety. But if we are in that more relaxed state, that the energy and the tissue healing can take place more.
So speaking of tissue healing, I know scar therapy is something that you practice and something that you are able to teach people like myself and other people who've been through surgery. So can you explain a little about scar therapy? It's not something I've heard of until I met you.
Yeah, so it's growing, definitely. People are knowing more and more about it now. So basically, we know that when we have surgery or radiation, it affects the tissues of the body, and it changes the collagen, so that elastic connective tissue, to a different type. So it becomes much firmer and denser and less flexible. And we also know that when tissues heal, then we can get adhesions. So it's almost like the body decides to lay down like a scaffolding around a wound to create stability where it's lost stability because of the incision or the radiotherapy. And what that means is that these little tendrils that are sent out from the scar, they might be attached to different organs or bones that shouldn't really be connected. Okay, so scar tissue is helping to release adhesions. And for me, it's about inviting those tissues to go back home. It's like, yeah, well done. You've done your job whilst there was instability in the body, but now everything's healed. So you can kind of go back home. So we're just helping to kind of unpick any adhesions and also get the layers of tissue. So we've got multiple layers of tissue from the skin down to get them to move more freely over each other so they can get kind of stuck together in very simplistic terms. So it's about us getting them moving more freely. So it'd help you if you're struggling with maybe pain around a scar site or even an unrelated area, but it actually is connected. So feels like it's a long way, but you've got discomfort. It can also help with numbness, hypersensitivity as well. Yeah, all of those things.
And how do you do it?
How do we do it? So it's a hands-on therapy.
Okay.
It's very much a pain-free. So we're working at the level of the fascia and the myofascia. So it's not about kind of breaking scar tissue down. It's more about encouraging it to move more freely and move back to where it belongs. Um,
And is it your hands-on,
you could do
me,
both.
or
You could do both. So you could be in person, or you could do it online, and I could teach you like techniques that you can do yourself. It's quite
oh, so
nice. Yeah, sorry.
it's not something that I have to come, like we wouldn't have to come and see you or and have you do this. You can actually teach us how to do this to ourselves.
Yeah, so it's normally
Wow.
like 8 to 10 weeks post-operatively. You just need the okay from your surgeon to have scar tissue
Okay.
therapy. And yeah, you can learn self-care techniques online.
We love self-care. Honestly, I think it's the way forward.
Really is.
I really, really do. Looking ahead, speaking of the way forward, how would you, or where would you like to see the kind of this area of recovery in healthcare? I mean, there was a point, I think, when acupuncture was available on the NHS and now it's not. But I think people are seeing, I mean, you're mentioning scar tissue therapy, people are seeing more. I'm not even going to say alternative therapies. It's just a different approach. And as you correctly say, it seems to be an approach that's working. And how would you like to see this brought in? Can you see it developing and becoming something that becomes a medical qualification, or is it always going to be an alternative therapeutic qualification?
So for me, it's about the complementary. So it's like they're complementing Western traditional medicine. That's for me, that's like that's the dream, is when we bridge that gap between. So it's not seen as an alternative. It's like complementing. So I don't feel like it needs to be one way or the other. So I think that's where integrative oncology is building momentum now, because there's much more research to show that those two ways, there are alternative, but like the complementary, so your acupuncture, your Chinese medicine, yoga's in there, and really looking at people in a holistic way as like whole beings. So it's your emotional well-being, spiritual well-being, and your physical. And that's what a lot of the complementary therapies really embody, that kind of let's look at this person as a whole being. And sometimes that's what Western medicine misses out on, but they've both got so much to offer. And it's like, if we can just bring them together, it could be like mind-blowingly amazing. But I know that that's kind of slightly in a dream world, but it is moving. And like I said
Yeah.
at the beginning of this, like if I talked about yoga, when I was first as working as a physio, and like saying, oh, we could do a bit of this. And, I was practicing a bit of yoga nidra with somebody that was terrified about having another chemo session and things like that. I was doing it, kind of in the sideline slightly. But now, I've got progressive breast surgeons that are saying, bring it on. Like, we are doing all this work, with our surgeries, and, so much money as well. So they're thinking about money as well a little bit here as well, because everything costs. We're investing so much to help these people get better. We want them to be able to maintain this, when they leave the hospital, like how do people keep themselves healthy? And so they're like absolutely wanting to support, their patients with things like yoga, because they can see the benefits and they want that for their patients. So yeah.
Wow. This is fabulous. I mean, I think it's fabulous for community. I think it's fabulous for society. I think it should be brought into schools, into the education setting, everywhere. I mean, I'm firm believer.
Yeah.
Would you like to close our session today with anything? Is there a little takeaway you can give us today?
So I think a nice little practice that we can do. So it's just something that's very discreet. Something that you can practice. I think is always good to practice techniques. I think I'm going to talk a little bit around scanxiety. So that anxiety related to maybe waiting for appointments or treatments that you find stressful, waiting for scan results, test results, all of those moments that are very triggering. It's really nice to have techniques that can empower you to help to down-regulate the nervous system, because we can't take away stress. Okay, that is part of life. So it's not about having a calm nervous system all the time and that it never gets stressed. That's not possible. But what we're looking for is a nervous system that can regulate. Like for me, like learning techniques when you're feeling calmer can be then something that you draw on in those moments when you're feeling more anxious. Something that is really nice is breath counting. I think that's something that I can teach you. And that's something that you can do totally discreetly. Nobody needs to know that you're doing it, sitting in your waiting room, driving in the car, wherever it is. And so it's just breathing and counting. So we could breathe in maybe for a count of 4 and out for a count of 6. So in for 4, 1, 2, 3, 4, out for 6, 1, 2, 3, 4, 5, 6. So we could get in through the nose, 1, 2, 3, 4. And you might even want to breathe out through the mouth, 1, 2, 3, 4, 5, 6. Good. So that's a nice little couple of rounds, and it's something that you can just start to do. And it's normally doing, at least 4 rounds. So don't let yourself stop until you've done at least 4 rounds of that, because it's that many rounds that is going to start to make your nervous system feel like it's changed. But it's just in for 4 through the nose, out for 6, through the mouth. And if that's like, you feel like everyone can see me, then just do it in and out through the nose. But always trying to breathe through the nose is a good thing. That's going to warm the air. It's going to moisten the air and
I was
clean it.
aware of closing my eyes. I remember you saying a minute ago, you can do this when you're driving to appointments. If you're driving to an appointment, Don't shut your eyes, obviously, unless you're being driven.
Very true. Do not operate heavy machinery. Yeah. Yeah. So that's a nice one just to be doing. And yeah, I can teach you lots more if you're joining sessions. And yeah.
And you're on social media. How do we find you?
So I'm just India Gooderham on social
Okay.
media.
I'll pop a
Maybe we can
little
put that.
link up
Be
so
really
people
great. Yeah. And
can come and find you and follow you.
my business, my website is gentlerecovery.co.uk. So you can find out more about programs that I'm running and scar tissue therapy and all the things.
Honestly, gentle recovery, it says it all. It really does. Thank you so, so much for your time.
Oh, thanks
And
for having me.
it's been an absolute dream to have you come into my life and now into all these other people's lives through the work that you're doing with our charity and the people that you're going to meet. I think this has been a collaboration that was just meant to happen. So
Feels like it. Really, really happy. Yeah.
thank you so
Thanks
much.
so
All
much.
right. You take
Take care.
care. I hope you've enjoyed.
I did.
All right. Thanks again.
Thank you.
If you or someone you know has been affected by the topics discussed in this episode, support and information are available. You can visit Ocular Melanoma UK at www.omuk.org for guidance, resources, to connect with our helpline and others who understand. Remember, no one should face ocular melanoma alone.